is Joseph Phillips. I'll be doing an assessment of the thorax and lungs on this patient here today. Before I begin this procedure, I will have gathered all necessary supplies to include stethoscope, personal protective equipment, or any other necessary items that I would need for this assessment. I have identified myself. I've talked with the patient about the procedures that we're going to be doing today. I have washed, sanitized my hands. I've also verified the patient's name, date of birth, based off of her armband here, and then we're going to go ahead and begin the assessment. So immediately, the first thing that I'll do on the assessment is I'm going to just do a general observation of the patient. I'm looking at her work of breathing. I'm looking at her skin color of her face and lips. Sit back for me, please. Raise your chin. I'm looking at her trachea, making sure it's midline and not deviated. I'm also looking for the use of any accessory muscles. I'm looking at the collarbones, the shape and the slope of them as well, and also the intercostal spaces and the abdomen to look for any use of accessory muscles to help with respirations. Also look at her position, making sure she's not tripoding, assessing her level of consciousness, making sure she's awake and oriented and meditating well. Once I have finished that assessment and deemed all of these mentioned items as normal findings, I'll go ahead and assess her posterior chest. All right, so I'll have you turn that way, please, ma'am. Under normal circumstances, the preparation part would be placing the patient in the gown. That way I could expose the back for this assessment. We will not be doing that. All right, and so what I'm going to begin doing is I'm going to do another general inspection of the back. I'm going to check the temperature of the skin. Feels good. I'm looking at the spine, any lateral curvature or any other kind of abnormality. I'm looking at the shoulder blades, the scapulas, looking for their position and also their shape. They don't appear to be any abnormalities there. Also looking at use of any kind of accessory muscles, again, any kind of a tripoding position or anything like that. With normal findings, I'm going to move on to assessing for tactile fremitus. And for that, I'm going to instruct the patient to say the words 99, the numbers 99, each time I move my hand throughout her back using the flat side of my hand here. Okay? Go ahead and say 99.
99, 99, 99, 99, 99, 99.
All right, very good. So I have equal vibration sensations throughout when she, as it says 99 on both sides, it's equal. Then I'm going to move on to chest expansion. All right, so on the chest expansion, what I'm going to be looking for is I'm going to be assessing the amount that her chest is able to expand and then the recoil that she has with each respirations. And I'll position myself behind the patient, approximately T9 to T10 vertebrae. I'm going to ask the patient to go ahead and breathe out. Okay, taking a deep breath. Hold it. All right, breathe out. All right, one more time. Deep breath. Breathe out. Okay. All right, so that's good. Thank you. All right, so she has good, even symmetrical chest expansion on both sides of her region of T9 to T10. So then the next thing we're going to be doing, we're going to be percussing the patient. We're going to be percussing, listening for any kind of resonance, any kind of dull sounds, any kind of thing that may indicate that she has a collection of fluid or consolidation in an air space which should normally be hollow. So we're going to start with this left side. Okay, very good. You can relax. It's very normal. Next, we're going to be looking at symmetrical lung excursion on the left and the right. We are going to look for, again, use of accessory muscles. Okay. Symmetrical lung excursion, I'm going to have the patient taking a deep breath and hold it, and then I will percuss, and then I will have her do the same, but as exhalation. Okay, so behind her. All right, taking a deep breath and hold it for me. Okay. All right, relax. Okay. Now deep breath and then let it out and hold it, okay?
Okay.
Okay. Okay. All right, so we have about a 2 to 2.5 centimeter area that her diaphragm is flexing here. Okay. So then the next assessment that we're going to be doing, we're going to be auscultating breath sounds bilaterally on the posterior side. We're going to be listening for any abnormal findings, which would be intraoral, extraoral wheezing, or any kind of rales or sounds of fluid or consolidation in her lungs. Okay. All right, go ahead and breathe for me. In and out. Again. Okay, again. Slow down. Again. Okay. Okay. One more time. Okay. All right. So then the next thing that I'm going to have the patient do, and this will be the final assessment of the posterior side, is going to be bronchophony, egophony, and the whisper pectoriloquy. Okay. And so for the first one, we're going to have her say 99 as I auscultate her breath sounds. Okay. Say 99 for me, please.
99.
Again.
99. 99. 99. 99. 99. 99. 99.
Okay, perfect. Okay, and then for the next one, she'll be saying the letter E as I assess. Go ahead.
E. 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 E.
Okay, and then for the last one, the whisper pectoriloquy, she'll be saying, whispering 1, 2, 3. Under normal findings, I shouldn't be able to hear her saying that unless there were something going on, like if the patient had some type of a mass or a thick consolidation like a pneumonia or something of that sort. Okay, so I want you to whisper 1, 2, 3. 1, 2, 3. Just one right after the other, okay? Just whisper. Okay, you can stop. So perfect, didn't hear at all. So that will conclude the assessment of the posterior chest. I will have her spin around for me, please, young lady. Okay, and then we're going to do an assessment of the anterior chest. I'll try just a little bit. Do an assessment of the anterior chest. We'll be performing inspection, percussion, and auscultation. We'll be looking for the same abnormal findings that we did on the posterior side. We'll just be doing that on the anterior side. So we'll be going through that, okay? All right, so lean back for me. So again, under normal circumstances, we would have the patient completely exposed, but for this, we will not. So I'm looking at her skin color, I'm feeling temperature, I'm looking for use of accessory muscles, abdominal breathing, intercostal spaces. I'm looking for the slope of her collarbones, seeing if there's any kind of use of lifting those to help with expansion of her chest. I don't see anything here, so we're going to go ahead and we're going to percuss. Okay, good. I did skip palpate. We would probably palpate first for any tenderness before we went to thumping on her. Is that sore? No? Okay, and then we're just going to listen to her lung fields for the conclusion. All right, deep breath in and out. Again. Okay, good job. So my findings, she is a normal, healthy patient. She has no adventitious breath sounds. She has no tenderness, no mass, no spinal abnormalities. She has no clubbing of the nails or any indication that she has any kind of respiratory disorders or diseases or compromise at this point in time. And then that will conclude my assessment.